Cannabis, the country's most consumed illicit substance, has in the past been largely associated with negative racial stereotypes organizations had designed and perpetuated for their own malefic means. The substance has been labeled with a high likelihood of addiction, making law enforcement hesitant to approve of its availability across the states. In states that have legalized the substance, studies show an overall decrease in crime rates. In fact, in 2022, President Joe Biden declared that it was his mission to make sure that nobody went to jail for marijuana
just for using or possessing marijuana.
Purchases from dispensaries are uncontaminated, which have reduced emergency room visits for patients that have taken laced substances.
Several students are treated for possible overdose.
In a poll, it was found that the greatest support for marijuana legalization was from those under the age of 50 in Ohio. Politically speaking, 80% of Ohioan Democrats were in favor of its legality. Likewise, independents tended to lean left on the issue. It is estimated that cannabis would improve the economy through tax revenue, primarily agricultural tax revenue. In the first weeks of cannabis operation in Colorado, Oregon, and Washington, cannabis industries earned a combined $18 million in revenue. From an agricultural perspective, the state would benefit as more farmers can become a part of marijuana farming, resulting in increased economic production. Researchers have also proved that a 1% increase in marijuana sales has led to a 0.018% increase in taxable food sales in the state of Washington. This chart demonstrates the effective decrease in youth marijuana usage should the proposed referendum pass. It's predicted that an increase from the current Ohio Code's $150 fine to the proposed $250 fine would discourage more children from using cannabis. There is a sector of people that do not want the drug to be grown or sold close to their homes, otherwise known as the not in my backyard approach. Public concern also arises out of worry that the product will be easily accessible. Though accessibility can be decreased through
gummies
ID
and other
requirements,
sweets
age
containing
laws,
a
or
potent
possession
ingredient
limits
meant
that
for
purchase.
adults are sending kids to emergency rooms.
In a graph derived from data on clearance rates for crime in Oregon post-legalization, recreational marijuana has proved to increase clearance rates by 4.5% overall. Comparing data on cannabis versus alcohol-impaired driving, it was found that 12.1% of impaired drivers were under the influence of marijuana, and 28% were under the influence of alcohol. Of the 28%, 2.2% stated that they drove after drinking too much, whereas the national average for drinking and driving is 1.9%. Ohio was ranked 35 out of 51 on a Forbes list as the most dangerous states for drunk drivers. Forbes continued to highlight Wyoming, Texas, Idaho, and South Carolina as states with the highest number of drunk drivers involved in fatal crashes.
In fact, in Colorado and in Washington, for example, DUI arrests have actually decreased since legalization, and youth use also has remained stable, if not decreased.
It is important to acknowledge all of these states prohibit the use of recreational marijuana. Because the drug is not readily available, civilians opt for easier ways of achieving a high: drinking. Last year, Ohio ranked 5th amongst the states in terms of overdoses. Marijuana's legalization can not only decrease harsh substance abuse, but also educate people of safer and smarter ways to use substances in terms of relieving pain. There's a much longer list of side effects for alcohol than marijuana. Alcohol side effects includes an increase in a person's risk of stroke, liver cirrhosis, alcoholic hepatitis, and cancer. Scientific reports reported mortality risks were 114 times less with the use of marijuana than with the use of alcohol. Ohio was made the 25th state to legalize medical marijuana. Its legalization reduced opioid deaths by over 1,700. As of 2019, 575 physicians were certified to recommend medical marijuana to patients. They take a 2-hour training course that does not cover medical marijuana. Heightened education through training programs should substantially prevent opioid deaths by recommending medical marijuana. In the light of the benefits to the economy, health, safety, and happiness of Ohioans, it just leaves one with the question: what's stopping Ohio from legalizing recreational marijuana? Is this just the start, or could we see a new wave of policy reform throughout the state of Ohio in the coming years?